We're going to go ahead and get started. Oh, it got really quiet really fast. All right. Well, good morning, everybody. Welcome to our fourth annual IAS retreat. It's really wonderful to see all you guys here this morning. For those of you who don't know me, my name is Vicki Williams. I'm the Chief Programs and Communications Officer for IAS. Got it. So I really must say I'm really impressed by this gathering of people that we have today. We have just a great, diverse group of people. I think we have community members, we have esteemed guests, we have, of course, our wonderful IAS faculty members, we have some students and trainees, and so, IAS's mission really is to provide an infrastructure to promote transdisciplinary work, and I think that this group that we have here this morning really embodies that. And we have a great program that I hope you guys are all going to enjoy. This morning we'll be kind of reflecting and doing some highlights of the great work that you guys are doing. This afternoon we'll be getting a little more deep into discussions about how we can continue collaborating and accelerating impact, which is the goal of our retreat. So again, thank you all for taking the time to join us today. And with that, I'm going to turn it over to our director, Dr. Adam Leventhal.
What's up? It's been a year since we've been back here, but it's great to see everybody. As Vicki said, I think this is not your normal retreat, right? We try to be very inclusive. We got community members here, as Vicki mentioned, from our awesome community advisory board. We have doctoral students. We got fellows. We got, doctors practicing within the system and outside the system. We got people from Annenberg, School of Communication, Dwark Peck, Social Work, Dornsife, of course, Keck, and many departments, psychiatry, ER Med. And I think I'm missing one. Oh, of course, the Mann School of Pharmacy and our wonderful researchers there. So this retreat is about accelerating impact. And one of the key ways to do that, and the overall premise of IAS, just like Vicki was saying, is to bring people together, be inclusive, let them bump and connect, and come up with pragmatic ideas, innovative ideas, and solutions to addiction problems. So with that, I'm really excited to introduce our keynote speaker, Dr. Carolyn Meltzer. And so she knows lots about inclusion, lots about innovative research, lots about education, and has been an amazing dean over her first 6 months?
9 months.
9 months, okay. Yeah, time flies when you're having fun, right? So let me go ahead and formally announce her. So Dr. Meltzer, on March 1st, began her appointment as the Dean of the Keck School of Medicine and the John and May Hoovel Dean's Chair in Medicine. She's recruited from Emory University, where the past 15 years she had served as the William P. Timmy Professor and Chair in the Department of Radiology and Imaging Sciences. At the Emory School of Medicine, she also served as the Executive Associate Dean of Faculty, Academic Advancement, Leadership, and Inclusion, and Chief Diversity and Inclusion Officer. Prior to her appointment at Emory, Carolyn served on the faculty of the University of Pittsburgh School of Medicine. She earned her medical degree from Johns Hopkins School of Medicine and completed her graduate medical education at Johns Hopkins Hospital in Baltimore. She holds undergraduate degree in biology and neurobiology with honors from Cornell. She's an expert in neuroaudiology and nuclear medicine and has conducted research to understand the brain structure and function during normal aging, dementia, Alzheimer's disease, and psychiatric disorders in later life. In addition, she specializes in cancer imaging and has a subspecialty certification in neuroradiology with advanced training in PET imaging. And she's an amazing photographer too, really. Okay, so a warm welcome to Dean Carolyn Meltzer.
Do you have a great director or what? Thank you, Adam. You are amazing, and you have put together an amazing group of people, and I love the theme of accelerating impact because that is what you all do. So I know this is a busy time of year. Good morning. So glad you all were able to gather in the rush of holidays, although I'm used to sometimes seeing a little white stuff on the trees. We'll not see that here. But really today is the time to think about IAS, where it is, where it's going. And it really is a model for an institute that will indeed continue to accelerate impact. So when I first got here, I thought, well, it's like 41 institutes and centers, and what is all this? And truly, IAS is one of the absolute models, bringing people together from multiple discipline schools, and really thinking about the complex problems that only teams of scientists, clinicians, and community members can solve. So thank you for what you're doing. You're advancing transdisciplinary research, education, the community engagement piece that's so much a part of everything we do here at USC. You're disrupting the way we think of these disorders, challenging them in new ways and in real life situations. So I don't have to tell this group that the mission of IAS is so important, so urgent, and so timely. Addiction is a disease that impacts so many individuals, disrupts so many families, and we know that the pandemic has made it all worse. Data published by the CDC recently showed that deaths caused by alcohol use increased 26% between 2019 and 2020, killing more than 49,000 people. We've seen record numbers of drug overdoses during the same period. Overdose deaths have been increasing for years, but the strain and stress of COVID has led to continued spikes. Death rates nearly 50% higher in 2021 than in 2019, with 108,000 people who've died of a drug overdose in 2021. So, those are numbers, but they're people, they're families, they're community members, and they're deeply concerning. It could also signal, certainly, a turning point. Addiction touches so many lives, so many families. Long-term stigmas are starting to break down, and that's partly due to the work that you all do. More and more Americans are talking about addiction and talking about addressing it. And it's not just about the drug and alcohol abuse, it's about mental health, it's about healthcare access, it's about looking at the whole fabric of our communities. It's about food and nutrition. It's about teen tobacco use. And this is an institute that has impacted on some of the factors that lead to teen addiction, which has been incredible. Talk about impact. It's about our relationships with our phones. So we can get addicted in many ways. But it's also multifaceted. All forms of addiction are multifaceted, and so the solution has to be multidisciplinary, has to be woven into the community, has to be novel, and you are all willing to think outside the box to address problems in new ways. The old saying is that to a hammer, everything looks like a nail, comes from Abraham Maslow. I take this point to mean that if you want to solve a problem, first make sure you're defining it correctly. If it's not a nail, a hammer's not going to do the trick. And sometimes we need multiple tools. So where addiction is concerned, a single tool, I know you know, is not enough. And to end our national crisis, no matter how helpful or accurate one instrument is, we need a bigger toolkit. We need ideas, strategies, technologies that reflect new ways of imagining and understanding our world. Again, that is not just a hammer. That kind of bigger toolkit isn't so easy to create, but IAS is well positioned to take on that challenge and to become a national leader along the way. It's hard to believe that this institute was only launched 4 years ago, in 2018. But really, and when we think about the last few years, what has happened, you have truly accelerated impact and hit the ground running. You're looking at addiction from all angles, not one or two perspectives, building that bigger toolkit, thinking about the relationship of addiction and justice, addiction and health inequities, addiction and the environment. Your transdisciplinary approach to this issue is breaking down gaps in communication among researchers as well. You're catalyzing new knowledge, new solutions together, one breakthrough at a time. That's why I'm so excited about the work done at IAS, and you have my full support going forward. At the Keck School, I hope that we are broadly challenging the status quo. We're looking ahead to a time when all people will have access to their full health potential, and where medicine plays close attention to how and where people live in the real world. We cannot have optimal health outcomes unless those outcomes are optimal for all. That's one of the big reasons I came here, is because of the commitment to that purpose. IAS reflects this broader Keck School vision. You're challenging the status quo, you're asking the hard questions, you're taking on new ways of looking at these complex problems. I was really excited that IAS members recently submitted a P50 Center grant with co-leads from different schools. As an imaging scientist, I've worked across many disciplines, and I know that there's no such thing as a single discipline approach to complex problems. So engaging the riches within our institution of research perspectives, community members, lived experiences is something not everybody can do. I also recognize that we need more resources, there's more work to do, we need to bring more people on. The goals are ambitious, the work's demanding. I hope today's retreat, it gives you more fodder for planning that future, and I share in your commitment to making it a reality. Many of you know of Atul Gawande, the physician-writer who explores the gifts and very much the challenges of working in modern medicine. In his book, Being Mortal, he wrote, "We've been wrong about what our job is in medicine. We think our job is to ensure health and survival, but it's really larger than that. It's to enable well-being and to enable everybody to live their fullest health capacity and full life capacity." And I think that's what you are all doing with IAS, enabling well-being across populations, across families, individual lives and stories, which can be so compelling. It's reflected in everything you do, every task you take on, every grant you write, every outreach you plan. Even in this busy holiday season, and maybe especially in this holiday season, I know how connected you are to your purpose and mission, and I share in that with you. Thank you so much for allowing me to join you today.
All right, I think now we're all inspired. Thank you, Dean Meltzer. That was wonderful. And yeah, I look forward to continuing to work with you. And I left out Price School. We got Price School folks here, and we have Viterbi and ISI as well. So love it. Yeah. So moving on. All right. So this is like the hodgepodge portion of the retreat. And Vicki and I and these other amazing scholars listed on this title slide are going to get together and talk about various ways we think we can accelerate impact. And we're going to focus a lot about the lessons that we've learned so far. What have we learned? How can we make ourselves better? How can we adapt? So this should be fun. And, you know, we're going to try to make it like not as one way, us talking at you. It might end up somewhat being like that, but just raise your hand, interrupt, you know, raise questions. And we're going to have some more interactive strategy sessions later in the day for sure. But we definitely don't want this to be a presentation. All right. So why are we here? Why do we do a retreat in the first place? Sometimes like these retreats happen and then people don't think about why do we even do it. It just becomes kind of habitual. You come, people do presentations, and then you come again next year, you do it. So we don't want this retreat to be like that. We want it to be useful. So part of what we'll talk about today and one of our goals of this retreat first is we want to educate you on the opportunities that are out there. Some of you, we do a lot of stuff and there's a lot of people involved. And so what we found is the members and our collaborators, just by knowing what people are doing, what's out there, what types of resources there are, that triggers ideas. So we're going to talk a lot about that. About some of the programs that we've been doing. The second thing is we got to bump and connect. In this post-COVID, during COVID, Zoom age, we don't do that as much anymore, sadly. We schedule Zooms, and that really stifles creativity. Zoom is good for certain things, but this is an opportunity for you all to chat informally and think. I think the other thing that we need to remember is we need to adapt as an institute because the world's adapting around us. The addiction epidemic is getting worse. The contributors to the addiction epidemic are changing, new commercial interests. And we don't know what is going to be the next fentanyl. What's going to be the next e-cigarette? Who's going to be the new group who's going to disproportionately be impacted by addiction? We need to be adaptive to that. We also need to be adaptive to what's changing in the university. And I think we need to be adaptive to what's changing in society. And we know that I think at this point, post-pandemic, whatever you want to call it, folks don't have as much time and energy. There's the word burnout has been thrown around. I don't know if that's the right word, but we can't just continue doing the same thing. And of course, inclusion, which we've talked about, is critical to bumping, connecting, and doing all this, and learning from our past mistakes and our past wins and getting better, right? So what do we hope to get out of today? This is ambitious. There's probably a lot to, and maybe we won't know certain things we will get out of today, right? But one of the things I would like folks to be thinking about as we talk, advancing the DEI mission. If we don't constantly keep on putting in effort to address inequities, to diversify our field, we'll have the natural drift that happens, and that natural drift perpetuates the inequities, the inequalities, the homogeneity. So we need to keep on thinking about that at the forefront. Of course, we want new grants, we want new papers, right? For many reasons. I think what you'll see hopefully more in this retreat than previous retreats is our efforts to come together and come up with ideas to advance trainees. There's been a lot of great work by our education team, Terry, Jess, and Jen, who've been amazing, but a lot of folks, Daryl, we got some new grants. we want to take a much more active effort because we think that it's a low-hanging fruit to be able to help trainees, especially as us faculty and the resources that we have. Recruitment and retention. So what IAS is a secondary appointment institute. We're here to supplement your departmental and school role. And so we want to partner with departments and schools on recruitments and come up with mutually beneficial initiatives for faculty, students, staff, whatever. I think one of the themes of the IAS, and I think it's one that we need to continue. The idea is not to keep on doing that like intermediate incremental stuff. Sadly, some of the stuff that gets good grant scores, that just moves things forward. We should be pursuing innovative, high-risk ideas, and hopefully IAS can provide a forum and a mechanism for you to do that, because sometimes the systems in academia don't really facilitate that, right? But then on the other hand, there's gonna be low-hanging fruit, there's gonna be pragmatic ideas. Things that, hey, if we just did this, we could actually save people's lives. So I think that's where IAS is hoping to specialize in, those two kind of areas, immediate impact and then thinking really big. We want to make everybody's lives easier. We want to make our community partners who are out there in the real world saving lives easier. Students, it's harder to be a student. It's harder to be a faculty, I think. It's hard for staff too, especially with inflation and everything. So we want to make your lives easier and also more fun. And so with all of these goals that we hope to get out of today and coming together, what would you do with that? Well, it helps us develop our funding priorities, because the Keck School, the Provost, and the Cancer Center and the Department of Population and Public Health Sciences have invested in this institute, and we have some philanthropy as well. And so this is your opportunity to help be decision makers and decide where do we want to spend our money so we can achieve all of these. Does that sound good?
Yeah.
All right, no clapping. Okay, any questions or thoughts or anything? Vicki, you don't have a question?
Not right now. Not right now.
Okay, so in terms of accelerating impact, some ideas that we've come up with, I think, is embodying addiction science. Addiction science didn't exist, or it kind of did, I don't know. But I feel, maybe we could take credit for this. I feel like we can take credit that we invented it and what I mean by that is not doing science on addiction. I mean, addiction science, we have a definition on our website, and it's a lot of the things that we talked about, but about being transdisciplinary, about trying to move the needle and being pragmatic, and also having a focus, a constant ongoing focus on trying to solve inequities. And so I think by building this institute as a new paradigm, we want us to be really good. We want our LA community to be doing well. But it would be great if this pops up in St. Louis, or I say St. Louis because they started something like this at the University of Missouri St. Louis, an addiction science cluster, or other places, right? And so just like there are comprehensive cancer centers across the nation that the government spends probably billions of dollars on, we'd love it if there'd be comprehensive addiction centers that take this approach. So we need to collaborate with the community because we're so behind. Part of this, the academic systems. So we need to hear hey, this is an issue. They're always so much faster than us, and they know about what will actually make change and stuff that doesn't just sit in the tower, of course. We already talked about being pragmatic or innovative. And I think the other thing that makes this a challenge is like to simultaneously disrupt but also work within structures. Because academia, it's just by nature siloed. We have ologies, right? I'm a psychologist, so there's just natural kind of the way the systems are set up. So we've been working really hard here at USC to try to work with the system when we can and try to challenge it. And that's also a euphemism for many other systems. And then finally, what makes it hard but fun is to meet the heterogeneous needs, because Daryl's lab, who's doing mass models, needs something different than Ricky's lab, who's out there on Skid Row doing harm reduction. So it's always a challenge, but it's fun. And so the more active you are and the more you speak out, the more we can help and meet your needs.
So Adam, maybe you can tell us
Yeah, sure.
what works and doesn't work for outreach into the community. For example, I'll tell you what we've been
Sure.
with some of our programs. I'm new to the IS.
Yeah, sure. To tell everybody who you are.
I'm Mike Jackwick. I'm
Yeah.
in faculty in neurology and 12 other things.
Mhm.
But I've been working with Daryl for
Do you wanna? We should walk around with the
also.
mic.
We have some mics.
I'll try to speak loud. It's early. I know you need time to breathe, right? Take a rest. But so again, I'm Mike Jackwick. I'm in neurology, and my background's molecular biology and molecular biophysics. I've been working with Daryl for about a decade on addiction models and in preclinical. I also do a lot of clinical research with Giselle Petzinger and focus on that. And one of the things that we've been doing is looking at the way the brain takes experiences and makes new circuits. And 25 years ago, we started with exercise. Now every single patient with Parkinson's exercise. You cannot find one that doesn't exercise. So that's probably a lifestyle impact, I think. But one thing that Giselle's been very passionate about is getting into the community. Yeah. And for example, when she started this about 10 years ago, she went to a particular department and talked to a particular dean at the time.
Yeah.
And he was like, "What do you mean? We are translational. We make our pamphlets in Spanish, and we hand them out at the clinic." And that was the extent of what they believed to be community outreach. So what she's done is to begin to develop mechanisms. Yeah. Mm-hmm. And one of the, maybe I'd like to hear your experiences now. Sure. That I'm part of this. You probably hear from me a bit more in the next 20 years or so. But I'm interested in what your successes are. For example, one thing that we found was really remarkable was developing focus groups. Yeah. Where you actually go into the community, and actually she's been doing a number of programs with Plaza de Raza, which is the largest Mexican-American community outreach in the entire country. It's also the oldest. And reaching out there, using the wellness center at the old hospital. Thank you. Yeah. And the same thing. I mean, Daryl and I talked about this too. And one thing that we teach undergrads, RXRS. Daryl is the founder of that, and I participate in a neuropharmacology course that I teach. And we think we know what's going on, right? We all, as faculty, you're like on top of the world. But when you sit down and you say, like some classes, I'll just say, talk to the students, say, guys, tell me about your access to drugs. Where are you getting them, and what are you getting? And you learn so much in this kind of focus group. Yeah, and so I'd like to, maybe what your thoughts are, and what tools do you think are best for creating the link between the IS and the community?
Okay, beautiful. Thank you, Mike, thanks for joining as a member, and thank you for your ideas. So then we need to make sure that Mike is in the community engagement strategy group. So there'll be an opportunity to talk and get a lot of ideas. So thank you for kind of getting us started. Because the answer is not gonna, you don't want to just hear that from me, you know? You want to hear that from folks who are experts, and then come together, and then, the actual people in the community too. So this is awesome. I'm glad you're here. Yeah. Oh, sure. What's up, Len? Nice to see you.
Hey, hi there. I want to sort of feed into this by saying there's a whole, thank you. Service. There's a whole pipeline from, initial formative research that involves community engagement and so forth and so on, all the way up through iterative attempts to work with come up with ideas, to test those ideas, to integrate with technology, to do all these sorts of things. But then there's also the dissemination piece.
Right.
How do we reach the public? And there's some huge gaps there.
Yeah.
So there's, just for example, this is just one example, is on the app side. I mean, we have these things called apps.
Yeah,
we
right.
have these kinds of technologies that people can use. And many of them, we talked about mental health, many of them for mental health are not evidence-based, and there's no evaluation process for these. And so there's a big gap, and there's a big opportunity for having ways of evaluating things that the public can access when they have difficulty interfacing with the proper people to get help from. And there's no real clearinghouse, as far as I know, for that sort of thing. So how do you develop tools that are on that side of things?
Yeah.
You have something that might be effective, and you have research, but then what about the dissemination? What about
Right.
the servers? What about the people
Yeah.
that take care of those kinds of things that provide the evidence-based assessment and evaluation to the public, so that we could impact things that way? There are
Yeah.
many potential ways to increase impact,
Right.
but that's just one of them.
Awesome. Okay. Well, good. Well, there'll be more. Yeah, someone should monitor the mic. Lova's got it. Cool. Thank you, Lynn. So these are exactly the things that we want to talk about when we come together, because these are problems that require multiple different types of expertise, right? But these are opportunities that are out there. It's just a matter of strategizing. So, okay, awesome. Okay, well, so a little more big picture to kind of riff on the types of ideas that have been brought up so far. I love this picture. Like, picture is worth 1,000 words. So this is what we are. Notice that on the left side, like each of the little, I guess we have receptors, right, Daryl? Those are like receptors. And see how like they all are different shapes, and the different shapes fit the different disciplines. You can see there. And that's what we do. We try to make a place, an inclusive home for all these different disciplines, bring you all together, connect, incubate, support, and enrich. And then these are our products that we're trying to do, and then the impact is on the bottom, right? And so those are just some of the impacts, but really like this slide. So be thinking about that as we come together, and it's our job to be that like ball, I guess. What do you call it? The virus. That's not a virus. Those are receptors. Fine. We'll have to change our whole. Yeah.
Our whole thing.
So just a little bit about us, because we do have some new members too. So how do we do this? The mechanisms of IAS to accomplish that cute picture. So we have 3 research programs, and so fortunate to have awesome research program co-leaders who come from 2 different schools. That's part of the model. And these folks come together and develop and incubate ideas and projects and talk. So we have foci in health policy and economics, priority populations and health equity, and mechanisms and treatment development. And these cut across the whole entire university. We have a training consortium, as I mentioned, which we'll talk about because there's a lot of exciting developments there and opportunities for folks to be involved. That has these goals of programs, research training, placing students, and facilitating our wonderful Student Association of Addiction Science, SAS. Okay. Community engagement and equity focus with our CAB that's been developed, creating inclusive forums and connecting with the community. And then all the other types of support systems to make your lives easier, to make people more successful on the right side. And then there's some statistics about what we did this year. It's pretty impressive, but we can't say IAS is responsible for all those statistics. I wish we could say that, but I think we do play a role in helping with all those wonderful things we've done this year. and you folks have done. Okay, there we go. Yeah, comprehensive transitionary, everything. CCC stands for Comprehensive Cancer Center Model. That's kind of what this idea is based on, but bigger. Okay. So this is what we spent our money on. Thanks, Loba, for putting this together. So we spent a lot of money on developing research. So like pilot grants. And then there's like this bucket of cross-cutting personnel, staff, faculty, helping recruitments, helping retentions, and other types of resources that cut across the different dimensions. So that's a really big bucket. Our speaker series, our collaboration mechanisms, including this retreat, the education program, community engagement programs, and then we spent a lot of money on building a bar lab, which we'll talk about. I shouldn't call it the bar lab. It's called the simulated bar lab retailer dispensary. Anyway, so we spent a lot of money this year, but we probably won't spend as much money next year because construction's expensive. An amazing research leadership team, as you can see.
I'll interject.
Yeah, go ahead, please.
So I just wanted to can you hear me?
You need a press?
Hello?
No, that's not.
I'm really loud. It's okay. So this slide really just highlights the amazing co-leads. So as Adam just mentioned, we have three research groups, and then we also have our training consortium and our community education, community engagement group. And these people lead these groups, and kudos to Sarah. Just wanted to give an extra shout out. She recently joined us this past year and stepped into a co-lead role. And as Adam mentioned, so the model is to be a co-lead. It's led by two or more faculty, and they have to be from different schools. So this really just does embody the whole cross-school, mission of IAS. And these members make up our steering committee. We get together every month and we strategize, talk about challenges, talk about new ideas, and it's just the giving of the time of these leaders that really kind of provide the foundation of all the cool work that IAS does. So this is just, we wanted to say thank you especially to this group of leaders for all that you guys do to help the Institute.
Thank you. Yes. And the other thing is, if reach out to these people too, if you have interest in any of these areas. But you can always reach out to me or Vicky or Jill or Lobo too. Yeah, they donate their time. That's kind of about IAS, is like you have to donate incremental time sometimes in order to invest in what will come out of this. Yeah, they're an amazing team. So is our administrative team. So just want you to know that we have, of course, Vicky, who is the brains and the power behind the whole entire organization. So she gets like 80 emails a day that are IAS related, and she's very happy to answer every one of them, or forward them to me.
Or forward them to you guys.
Yeah, so some of you all don't know, but Jill, who's one of our newest staff, if you want to stand up, Jill. Yeah. So she's a gem. So you can reach out to her, and she plays a lot of different roles in IAS, especially with facilitating community engagement and education. Loba, the money man in the back, who does more than money, Yeah. April, I don't know if April's here, but yeah. And then we're thankful that Erica Apazita is helping us for the time being, but we will be hiring another a person, I should say, at the bottom. So if you have any amazing staff or people who would be interested in this position that would kind of cut across administration, all the various things we do, you need like special type of person, send us their resume. So another thing, so this is what you should know this. So building an administrative infrastructure, it turns out that's not really that easy at USC. Some people are rolling their eyes. They're like, yeah. No, but having Loba on this team is amazing as our Chief Finance and Administration Officer. I want you to know what's really important too is with Loba, we now have a grant submission and budget management infrastructure. So sometimes folks have trouble submitting grants with their own grants administration people in their respective department or school for various reasons. And so we're here to step in and help you with that. And also, if you have big ideas that cut across multiple schools or disciplines, center grants, other things, we have experience doing that and can do that for you. Okay. So yeah, we submitted a lot of grants this year. So you want to hear? You do this part.
Well, we just wanted to highlight some of the awards that our faculty, and this is not all of them by far, and I think just a snippet of Ricky's, we probably need an entire slideshow of just Ricky's awards in a year. But really, we really just want to recognize all the wonderful work that everyone does. And if you don't tell us, we don't know. So please keep us updated, and we'd love to be able to highlight these successes of our IAS faculty and staff.
Yeah. So if you let us know, we can publicize it, because who wants to really brag about all the good things you're doing? That can sometimes look a little conceited, but you can if you want, right? But what we want to do, you should do that, sorry. You should advocate for yourself. But we have a broad network, so we can promote you, and we want to promote you, right? So just, you got to let us know, like the cool stuff you're doing, papers too, anything.
Can you guys talk to stuff?
What?
Tell us the people. Come back and
What go?
shout-outs, yeah.
Oh, okay. Well, Jessica Barrington Trimmis. So Jarvik Russell, new investigator award. That's like so the Society for Research on Nicotine Tobacco is the biggest tobacco international organization. It's got like more than 1,000 members. And so she won as like the best early career researcher in the whole entire organization. So yeah, way to go, Jess. We'll just do a sample here, right? Because some people are not here. Yeah, oh, Heather won a mentoring award. Heather's here. Heather does a million things. I don't know how she does it. She runs undergraduate programs. She has these large UO1 grants. So if you want to collaborate in the area of global health, global tobacco control, she's your person. And I think she does have some collaborations with folks here too. So that's great.
Lynn Miller's here. And Jen.
Lynn, a fellow of the International Communication Association. So I don't know much about that, but it sounds really, really important. So congratulations, Lynn, who also is the Vice Dean of Research for the Annenberg School. So she wears a lot of hats. So congrats, Lynn. So Jen has a Fulbright Specialist Award. So that's really impressive, because you say the word Fulbright, everybody knows I don't know exactly what it is, but I know it's really, really important. So, but congratulations. And I know she had a book that came out maybe a couple years ago. So she's been really busy, and you've taken over a major educational role at the School of Social Work as well?
Yeah, the chair for the MSW.
Okay, way to go. People who do well just get more rewarded with more work, right? Am I missing anybody?
Ricky.
Oh, well,
But,
come on,
I mean,
man. Everybody always
Ricky.
talks about Ricky. Tell us about one of your 7 awards that you won.
The one I'm most happy about
Okay.
is the entry award, because I love my grant.
Well, congrats. Well deserved.
Terry wrote a book, too.
Oh, you did? Of course you did. Oh, that's right, you did. So tell us about it's a textbook, right?
It's a textbook. It's all about addiction through history.
And can we find it on Amazon? Where would we find it?
Not currently. I'm just finishing the edits right now on proofs. So maybe in a couple of weeks.
Okay, great. Well, we need texts for our master's in addiction science program, as you know. So so congrats, Terry. Yeah. Okay. Congratulations, all these people who got promoted. Way to go. It's not easy to get promoted during the pandemic, and I'm sure, anyway, we're probably missing some too, so if we don't know about it, we can't promote your promotion. But way to go. All right, so we're gonna now we're gonna hear less from me, and we're gonna start throwing the mic around. All right, so John, where's John?
John's over there.
Oh, there he is, he's up. All right, so we should give
Lova's
him
coming over.
Oh, thanks, Lova. I'll give him a mic. So we're going to talk about, so now this is a portion where also we're going to talk about narrative stories, about how folks in IAS came together. And it's not just to brag, but it's also, if you guys see a narrative or an example of how this works, we want you to say, oh, wow, that's really cool how that happened. I want to do that too. And then you'll get more involved. So that's kind of the motivation.
Yeah, this is great. Adam said I didn't have to make any slides, and now I don't even have to get up. This is really... So I had been working with Shen, my friend Shen here, and Katie Page in medicine, and we've been working on the effects of sugar and non-nutritive sweeteners on brain activity that's relevant in appetite. So this was fMRI work. And I was thinking about the potential relevance of this to vapes, since there's sweeteners in vapes. And some of what we were doing had to do with the experience of the flavor. And so I approached Adam, because I don't know a lot about vaping, and he connected me to Elena Tackett, who, is Elena here?
No.
No, Elena is leaving. That is a sad thing for me, but she's leaving USC. But anyway, so he hooked me up with Elena Tackett, who came at this issue with a lot of knowledge about vaping and also with a lot of interest in regulatory issues. And there's an obvious connection, because you can regulate flavorings in vape. So we kind of partnered up, and she changed the way I was thinking about this. This was a different framing for the grant, and it was, I think, the right framing. It worked, it got a good score, got funded the first time through, and we've started that project now. It's about 8 months into it. It also led to a couple other grant applications that are currently under review. So it was a really clear, very specific case, and I just like abstract. I specifically was connected with people, or someone in particular, and led to new connections after that. But that facilitated this particular, how we were going to address this question. It changed it. So, it is, as people have been saying already, it is challenging at any university to know the people who are relevant to your work. It's a little bit maybe extra challenging at USC relative to some places I've been, because of the way that things are structured and also the physical separation of campuses. So, while an institute like IAS, I'm sure it could be helpful anywhere because of the natural siloing that happens, at USC it really feels like a tremendous incremental value to me. Lots of people that I know now that I wouldn't know otherwise, and lots of collaborations that are building over time. So I am grateful to IAS, and I think this is like a good specific example of the way it can help people's research.
Okay, thank you, John. You want to clap? I think you want to clap. Okay, cool. And then now there's a new exciting line of research, and I think also part of, so I'll let Eric, and I don't know if Jordan's here, but talk. You can come up, because you got a couple slides, and then there's also an opportunity for resource sharing and your data, right, and other specific, yeah. Sure.
Hey, I'm Eric. Jordan wasn't able to be here today, so I'm just going to go through the slides. So we created this line of research. I'm going to give you a little bit of a history between Jordan and I. So he was a I used to be at RAND. I was at RAND until 2020, February, right before the pandemic. And he was a graduate student and had emailed us at RAND about trying to get some collaborations together. And we connected that way. And then he was telling me about how great USC was, and they were starting up IAS, and talked to Adam. And eventually I came over here. But I mean, just in terms of why we work together, I mean, we do basically everything together. We're research partners. We're also really good friends. And I think, you know, it really stems a lot from that, and just finding people that you really like, going out, getting a drink together, having dinner, and then just having these conversations come up and saying, hey, we should write that. And also, you know, meeting people that, this is something I've found that is, you know, ideal about him, is a lot of times we come up with ideas and we think of things that, you know, great ideas, and say we should do that, and then it just, nothing ever happens. And so finding somebody that actually can follow through with those things, to the point where, I mean, I can't even keep up with him anymore, but he's just a good partner to have. So that's always just something to look out for on the people that actually follow through. Can I advance? Yeah. Oh, I did, okay. So I'll talk about, so we have this line of research now that's really focused on helping veterans that are outside of treatment settings receive treatment, or help bring them into care as well. And so this was a study that I was doing, which is to develop a brief intervention for veterans to help engage them in care and try to bring them in to seek care at the VA. And then we got a supplement when COVID hit, and we had some data that actually we collected right before COVID, and then thought, hey, let's follow these veterans and see how they're doing over time. And so this is a nice partnership here, because this was an intervention study, which is the thing that I really like to do. And then we had all these data that I don't know how to analyze, and Jordan does. And so connected to actually analyze these data, and just, I know I don't have a ton of time, but basically these are just two slides that look at our baseline data through 24 months of the pandemic, showing that, you know, overall veterans are actually doing pretty well during the pandemic in terms of, you know, we didn't see big jumps in their alcohol use, cannabis use, PTSD, depression. But you can see that the darker lines here are those that were actually worse off before the pandemic at baseline, and they kind of stayed at this elevated level. So just a lot of support to show that we really need to help veterans that are outside of these treatment settings. And so then we partnered with some researchers at the VA, and they have an app for mindfulness. It's and we enhanced that with some alcohol mindfulness-based relapse prevention content. And that was really cool, another really great partnership with them there. They had this app that was already developed. It didn't target alcohol use at all. A lot of veterans with PTSD use alcohol, so we enhanced it with this alcohol content. And just launched this study last week, and are doing really well. We've enrolled about 20 or so people. But these are some data from the beta test that we did with just 16 veterans. So it's just pre-post. You know, I wouldn't read into this too much, but it does look like from baseline to follow-up, we are seeing some changes, some pretty big effect sizes in terms of reduction in PTSD and alcohol outcomes just over the 4 weeks that they were using the app. So stay tuned. We'll definitely present some. We're doing the RCT right now, and we'll present some findings from that at some point. And then the last thing is, so he was going to do this slide, and so he made me put the Jedi in here, because I guess that's how you pronounce JITIA. And so he asked me to put the Jedi in, and I said, I could go really deep with Jedi, but maybe we should just use Luke Skywalker, because I don't know what the crowd is like. But if anyone wants to talk about real Jedi, I could do that. But this is a grant that Jordan has, and so it's using machine learning, which is another area that I'm getting, you know, more and more involved with. But this is one of his specialties, again through a lot of these connections. And it's giving veterans Fitbits, and they're using their cell phones to track their symptoms and all this, all these you know, physiological measures, as well as social measures, how many phone calls they make, texts they make in a day. And we partner with some researchers at King's College in the UK to actually try to predict when we're going to see some increases in PTSD symptoms, as well as increases in cannabis use. So at the basic level, we could look at cannabis use and PTSD symptoms at the daily level, but then what happens in terms of physiological measures and social measures that might increase those. And so the idea here is that we could then use these to develop these just-in-time interventions based off of the data that we collect, but also using a lot of the devices that people use in their daily life. So yeah, happy to chat more about these. There's also, we have we're collecting lots and lots of data. We are open to partner with students, postdocs, other researchers, so please reach out to either of us if anyone's interested. Thanks.
Thanks, Eric. Oh. Olivia. It's hard to get access with the VA and connection, so yeah, if you're interested, talk to Eric.
Yeah, so like the one that I'm gonna talk about is the kind of how the collaboration and everything, and actually the conversation from here, from retreat last year, how that one has evolved into a paper. And it has been like with last year here, we had a conversation about like a lot of people, a lot of folks are interested in LGBTQ youth population. And then like the Evan has said like, okay, there's really cool data. Think what, and then maybe I can navigate that one and a whole kind of stuff, and voila, we have a paper. And it has involved a lot of people from a lot of schools within the USC, like psychology and school of social work, the Keck School, and Annenberg, and we have all of them, like Children's Hospital, and even outside USC and Tulane University, and some of our colleagues are in London. So that conversation here, and even like, like a hallway conversation kind of thing, that can be a prompt, and it can be seed for the paper, and there's some grant idea for grant, and whole kind of things are going on. So that I think like the message that I'm trying to convey here is that whatever conversation we have here, it can turn into concrete whatever products that we want. So that's just one example of how it can evolve for the collaboration.
Thank you, Olivia. Yeah, so there's the similar idea here. I'll just quickly say that there's a really cool collaboration happening between Daryl's lab and the liver GI folks. And Brian Lee, who's an awesome physician scientist who we funded, got a K-23 and has mentors from different areas of USC that's been connected, and so they're working on some really interesting potential interventions and health services approaches and novel supplements and DHM that Daryl has pioneered in his lab to move into humans and really try to reduce drinking and also benefit the livers of people who drink. So some really exciting work coming up there. And Alexandra, you wanna? Yeah. Here. Do you want to come up, or you want to? All right.
Hello, everyone. Thank you for having me. I'm going to chat a little bit, give a very high-level overview of what the work that we've been doing at the Schaefer Center, led by Dr. Rosalie Bakula. I'll start with our white paper that was published this summer in 2022, which gives a summary of our work showing how cannabis legalization policy is not sufficiently capturing potency right now. So potency, THC, CBD in products, and also dosing. And how at the federal level, what we can do at the federal level to improve public health. So after releasing this, many policymakers, regulators reached out and asked us what is the best way to cap potency. So moving forward, on the right-hand side, this is a table from a recent paper that is currently under review. A lot of this work originated from my dissertation and has continued at USC here. And what we're showing is through point-of-sale data that we're using, we are able to look at these questions by tracking patients across time, longitudinally assessing what products they're using, and linking that to patient characteristics, age, sex, condition, and symptoms. And one of the key findings from these studies has been that patients are using much less potent products compared to what are we seeing in the rec market. So that has really captured the attention of policymakers and regulators. So to summarize some of this work that has been already published in JAMA Open, this is currently under review at the New England Journal of Medicine, and we've presented at several conferences. We've been invited to give presentations at Washington State. We've presented in front of the Senate Finance Committee and the Help Committee, and we currently have a few presentations coming up at NIDA and UNODC. So to just summarize, this white paper, along with the point of sale data, has really allowed us to have really great, meaningful conversations related to cannabis regulatory policy.
Yeah, thank you, Alexandra. Yeah, congratulations, and I know that you have some funding hopefully pending, and so fingers crossed for you. But in terms of, one potential theme as we strategize later, is this cannabis regulatory policy piece and the resources they have at the Schaefer Center and other types of resources about how the cannabis landscape is changing. So thank you for talking. Okay. Well, I'll go quick. I just want to say we have this data source on the left side, this Understanding America study. There's 10,000 adults who's been measured every 2 weeks or every month. We have substance use data. It's a partnership with the Caesar Center, and they funded part of this as part of their ongoing study, and we funded part of it as well to keep it going. So I think there's about 36 waves of data, and there's a couple of publications coming out. One of them is up there, just tracking substance use. And so if you want those data, which you can have. Junhan Cho, I think he's in the audience, is the master methodologist overseeing that. And so that is data that we have used to leverage to submit grants to. A couple, one that got us in 17, it was an R21. So I worked out. This is a really unique data source. So hopefully there'll be chances to talk about it later. So who wants to talk about the Bar Lab? Jess? Come on. Okay. So yeah, I'm really excited about this. Okay.
I'm so excited about it. Ridiculously excited about it. So do you have like the picture of what it actually looks like? Okay, cool. So we need to have a cool name for it. So if you have any ideas about like a cool name for this lab space, it's really cool because it's a versatile space that can be a simulated bar, a simulated cannabis dispensary, a simulated food retail space if we want to do food addiction stuff, and how convenience stores and gas stations may contribute to that. Or like a tobacco vape lab, a vape retail environment space. So there's information up there. This is like the basic plan for what it looks like. The thing in the middle is really cool. It looks like a bar. You can flip it around, and it's got like it looks like there's like glass windows.
Show the pictures. Yeah.
Yeah.
Okay.
So we have we just submitted our first. One of the first grants to use that space. We're going to make it into a vape retail environment, and we're going to manipulate some regulations regarding flavors and packaging and things like that. So it's an awesome space, and people should definitely check it out. It's almost ready to go. Yeah. It's in the CSC building on Alcazar, like right up the road over there. So and if you have questions or want to come by, let us know. We can give tours.
Yeah, that'll be part of the strategy session as well. So that's the thing that flips around that Jess was talking about. That's the bar. I mean, yeah. So it's coming together really nicely. So something we're investing in, and we hope that Jess's grant will get funded, but more grants will be submitted. And this is really an opportunity to do stuff that's in the clinical realm, like having people who are practicing relapse prevention skills training in an environment, for instance, where it's really, really hard and there's temptation. So there are a number of different applications which we can talk about, but should be pretty sweet. A lot of the 3 great programs One of them led by Daryl and Terry, a new R25 program. And so we'll talk more about this in education, but training underrepresented addiction scientists from undergraduate students at Charles Drew, Cal State LA. There's another collaboration with Charles Drew and Cal State San Bernardino led by them that we participate in. And then Alice and Lalo from the School of Social Work have had a long-standing R25 where they've been training Hispanic trainees in substance use. And so the opportunity here, which we'll talk about later, is like put students in your lab, guest lecture, and do other things to participate in these programs. The training consortium we'll talk about later, but we got a master's program coming, excited. I'll let Sheila. Sheila, can you please talk about your association, because we'd love to connect with you more, so go ahead and give us a rundown.
Hi everyone, I'm Sheila. I'm a fifth-year PhD candidate over in health behavior research. Thank you so much. I'm also the president of the Student Association for Addiction Science, and we're housed under IAS. We started back in 2020, so we're a very new organization, and we're really excited about collaborating with IAS and bringing students into labs, into mentoring opportunities with our faculty here. So that's something we're really looking forward to. I'll also pass it on to Nina, who's our VP of Civic Engagement.
Hi everyone, my name is Nina. As Sheila said, I'm the VP of Civic Engagement. And so we're looking forward to continuing to build SAS throughout the rest of the year and have a really strong turnout of our basic e-board base to continue it strong, as Sheila and I are both graduating this year. So we want to make sure to continue the SAS legacy very strong.
Thank you for having us.
Yeah, no, of course. So there'll be an education-focused strategy session. And so you need to tell us what you need, what you want, and we're here and we want to support you. So thanks. Great speakers. I'm going to go through this fast, but there's really good speakers coming up. The main thing is, if you want to have a speaker come, just tell us, and then we can invite them. The rate-limiting step is getting names and ideas. So we really love to have more speakers come, and we will continue to do it. But this is really an opportunity. We pay for them to travel, you know, the deal. And there's also a training networking session when each speaker comes, and they talk about career development issues. So it's really good. Okay, now it's Ricky's turn. He's going to talk about community engagement and dissemination. All right. Vicky says you have to come on up, so if Vicky says something, you got to do it.
So the community engagement thing is led by myself and Alice Cepeda from the Social Work School, who's mentioned earlier and does great work and has for many years. Next slide. Or I can move them, sorry. There we go. Okay, so the first thing we did was we convened this diverse group of community advisors. They've already contributed a ton to both ideas about things to do. Some of them are here, so I think, who's here? Yeah. Stephanie's here. And then Amanda, it kind of isn't on the board, but it feels like because she gives me all kinds of great ideas. Anyway, we've met a couple of times and gone over the programs. The INCLIR proposal that Adam and Rosalie put together was sort of vetted with them. And we've started developing new programs as a consequence of these connections. You know, one big motivating thing that I'll share with you that's been important for me in thinking about community engagement in the addiction science world is that solutions that don't work in communities are not solutions. And so that's sort of the goal that we're trying to overcome is, you know, actually understanding what's happening in communities so that we can actually develop things that will work in communities. And in my career, because I've done work on HIV for many years and also opiate use disorder issues, you know we have terrific biomedical interventions, often that don't get into community settings in ways that they need to. And that's because we've sort of designed them in the university and they look great to us. and they don't work in the community. So that's the sort of motivating impetus behind this. And then we have some great people. If you don't know John Ma, I just want to give him a shout out. He's this surgeon. He's like crazy smart and like amazing experiences and has incredible stories to tell. We've been doing work, and you'll see it later. Sid Ganesh, who's one of my doctoral students, has been doing work on infective endocarditis. And we sort of have this harm reduction approach to it. And he's really given me insights into like what actually happens in clinics and in surgery with people. And so I'm way more aware of how complicated it all is than I was before, which was helpful to me. And I always appreciate what I learn from people. So I just want to highlight him. And then we have Sigalina, who's that sort of czarina of outreach in Skid Row. So they're like important people in the community doing great work. And of course, Stephanie from Homeless Healthcare, which is, they're growing and on the front lines trying to provide really important work. And we use one of their sites now. So for one of my studies, we recruit at the Refresh Center. So these are assets for you all, and I would encourage you, if you're interested in sharing your studies with this very wise and knowledgeable group of people, I would encourage you to do that and get on our agenda. And then I'm happy to facilitate relationships in terms of meeting with people and sharing your ideas. And there was that question earlier about how do you do community engagement. And I think I have like really two things. One is you have to let people know whose side you're on. Right? So I'm on the side of the people in the community always first and last. So that helps. And then the other thing is you have to build the relationship. So you have to put the time in. So, I'm very happy that like my relationship has matured with Homeless Healthcare. We've been interacting for 20 years, probably longer, probably 25 years. But, and the relationship goes through ups and downs, right? But, we're in a good place now, which is awesome. But you know what I mean? Like that's part of it. It's like you're in a relationship, so you have to keep engaging and learning and adjusting, and hopefully they'll do the same. Sorry, Adam, I'll finish. No, you're good. People are texting me. That's why. Oh, okay, sorry. And so we did one of the things that we're really trying to operationalize is our capacity as conveners. We have these nice physical space that people can come to. It's sort of neutral area to discuss, important and challenging issues in the community. So we did a great, I think, multimedia. Basically community discussion about safer consumption sites in advance of Gavin Newsom vetoing it. But in any case, I felt like the community came together in a way that they actually hadn't. And it was in a safe space, right? So people were able to share plans without, some of the acrimony that can go on. And then this other thing we're doing that Amanda has really helped to sort of have a vision for, and we're trying to operationalize, is the workforce development stuff. And, this is really important. I know all of us have some connection, have someone in our lives that has a serious addiction problem that's, probably really disrupted what's happened in their lives and had emotional impacts on you, on yourselves. You may have your own addiction issues. But, one of the things, we're all relatively privileged. I can't speak for everyone in the room, but, things are generally going well. There are a lot of people out there hurting. When you hear things like, 20,000 overdoses were reversed by community peers in Los Angeles County. I just made that up, but it could be. But the point is that someone else did that, and that's hard labor, and that's taxing, and it's soul crushing. And so what we're trying to envision is an ongoing set of activities that are around these frontline workers and building them up, giving them opportunities to get self-care and get care from other people and recognized, and then really trying to operationalize that. I mean, one of the things that the war on drugs has done, and without me going on a rant about this, it has literally destroyed a bunch of people's lives, right? Anytime you spend in jail, it's time your life is being destroyed. You lose all kinds of access to opportunities. A lot of these frontline workers are the folks who have those backgrounds. And, so we need to create pathways for them to have lives like ours, right? Where they're securely housed, well-fed, they have a decent income. And so this is sort of our first salvo into that space. And hopefully with all of the resources we have and intellectual power, we can really uplift this really vital part of our community. So that's sort of the goal for that. Rebecca's not here, right? Jill, though. She is here? Oh, she just showed up. Come on up, Rebecca. Your timing's amazing. And I don't even mind that you took my seat. That's great.
Hi, everybody. I'm Rebecca Trotsky. For those of you who don't know you, I don't know you, you don't know me. I'm a family doctor at USC, and I have the honor and privilege of working with so many of our activists and our community members and our other physicians on a number of projects. One of the ones we've been working on, in addition to codifying safer consumption access for the county and really trying to re-educate that culture shift that needs to happen for the healthcare providers, is working on how we can shift support for people who use drugs who are pregnant or parenting. Historically, that's been a mandatory report for DCFS, and so that leads to family separations. And just like custody and confinement, when we take families and rip them apart, it's never actually a benefit to anybody in that equation. So we've been working pretty hard with a bunch of partners, some of them who are totally like, yeah, I've been waiting for somebody in this moment, and some of them are like, I don't understand. Why do you want to like kill all the babies, right? Like, we have a lot of naysayers in our community, unfortunately. So we get to really lead with DCFS, our social worker partners, our healthcare providers, our OBGYNs, our pediatricians, our ER docs. And right now, Harbor UCLA, which is one of our county hospitals, is partnering to develop what they're calling mandatory supporters in collaborative care. So when somebody is using drugs and they're pregnant or parenting, rather than turning first line to our social work mandatory reporting structures, really looking to engage that broad breadth of support for that person and that family. So it's really exciting. This is work that's going to be ongoing probably for the rest of our lives. And it's really exciting to have an opportunity, I think, at the county to finally, like, politically be like, we're all on the same page at this level, and we just have to figure out how to make it work. So I say that as if it's easy, right? But it's not, and I appreciate all of you and all of your experiences coming to the table to help us do that. So happy to talk to you over lunch. Come and say hi. Come hang out with me and all the other healthcare providers whenever you want, and we can show you how fun it is putting our policies into action at that front line. So,
can you talk about the Leadership Council thing?
The Leadership Council, which one?
Is that the one right to the, is that you?
Is this Sid? No, this is the flyer for the meeting. Oh, for the meeting, yeah.
Oh, okay, sorry. No.
So we had a meeting at the the California Endowment Center that really brought together a bunch of stakeholders, and that's kind of now ongoing over Teams and continuing to occur on the regular, and I'm hoping to get a youth SOR grant, which would kind of put into action some of the quick start protocols for kids in our juvenile justice and our DCFS systems who are pregnant and parenting, or just young themselves and want to get engaged in this work. So this is always ongoing, always like a mystery exploration of how we're going to do the next steps, because it's not always obvious. Like, in forward speed, in retrospect, I think we're like, oh, this is totally logical, of course this makes sense, but like, going forward is always a mystery. So we depend on having a broad spectrum of voices and community partners like you guys. So come on and say hi over lunch and help us do the work. Thank you.
Great. Yeah. So there is a program that was run out of internal medicine. I don't know if they still do it. I think it's Forum Theater that has been used to help people reimagine the clinical enterprise and sort of problem solve for the various different constituents. So I'm aware of that. We actually did try to get money to do that and move it over to the Keck side, but we were unsuccessful. But
Yeah, we have a grant that actually does that.
Oh, great.
We've been doing it for the last few years. We just had one at Plaza, actually it's 2 or 3 times now, where we had somebody, thank you, where we had somebody write a play. It was focused on dementia.
Yeah.
And the experience of dementia, and trying to educate as well as and get information from people. So we had somebody in the community. He's a screenwriter. He wrote a play, a 5-minute play, which we put in both English and Spanish, and we put it on at Raza. We had about 150 people show up, and then we had the actors stay in character. and then engage the audience for about 2 hours, and people sharing their experience. And it turned out to be an amazing, and we have some fun. We got a collaboration grant from USC for this, but it's an amazing mechanism to really tap into, not only to educate them, but also to do it in their community and find out what they're thinking and doing. And it was an incredible tool. We're actually writing a paper on it right now, and a review article on this mechanism. But we're also doing dance, and so it's another mechanism. And they're really amazing tools to then engage the community and put them in their comfort zone and their cultural zone, because we found that we've been using the wellness center, and the challenges of having people, just come over to the campus and we've got an auditorium for you, and they're like, no, I don't go there. Yeah. And that's always been, but within 2 miles of SC, there's like probably 5 or 6 black box theaters that I can think of that are these amazing sites for these types of engagements that are really remarkable.
Yeah, there's just another group, and I'm gonna get the name wrong. It's theater like 1001, something like that. That's on First Street, I think. And they do a similar work around mental health in the Latino community using those same methods. So So there's a lot of great stuff happening in the community. Yeah. So I think what I want to just emphasize is, like, the thing about putting it in the community is also recognizing, like, we don't know how these things are dealt with in the community, right? Like, the only way to see them is to actually be in the community and figure out, like, how do families actually deal with, elders that have dementia. And there's so much to learn from being with people in their space rather than bringing them here. So yeah, and then follow us on Twitter. Now, I just want to say, Twitter, who the guy running it now is an insane person. So just,
he's listening.
He probably is. I'm about to get kicked off. But if you follow me, I have the best Twitter experience ever. There are no creeps or trolls in my Twitter feed. It's all science and people in the community doing important and meaningful work. I mean that. Like, I'm so proud of my Twitter. So follow me too, RN Bluthenthal, follow IAS. It's all good stuff. Thank you very much.
Yeah, so if you tell us about your stuff that you're doing, we could tweet it and people follow us. Okay. And we can do little like things about your papers or other types of projects, that snippets thing. The team came up with, it's pretty cool. So on Instagram, I guess. Yeah, I'm not on that one. But I just want to say about the community engagement and stuff Ricky and Rebecca were talking about. Like, Rebecca just texted me like, hey, I have an idea. Can I talk to you? I'm like, yeah, what's up? And then she's like, she talked about the program with pregnant patients who use drugs. I said, sure. And I just connected her with Jill, our amazing staff person. And so we supported making it happen. If you have an idea, there's some ideas, you come to us. And we can help facilitate and make it happen. So that's how the community engagement programs seem to happen. We're not going for RFA grants and whatever, but there are funding sources externally, but we can fund them internally just as a service to the community. So that kind of happens organically. But yeah, no, Ricky and Alice are doing great work and our amazing CAB, plus Amanda. We really, really are grateful. We should just make it official, shouldn't we? Anyway, whatever. Okay. Anyway, so this is just, Vicky's like, you have to like end on something, so there's like a timeline of IAS, like something that ties it all together. Basically, you don't need to look too much at this. The point is we're here to figure out what's next. We come a long way, a lot of great, amazing collaborations coming back when we were in, what was that, Westlake? Remember that, Daryl? Yeah, that was a long time ago. But yeah, so let's keep it going. Thank you so much for your energy and effort. So we're gonna skip like a general question and answer session because we're really fortunate to have Hide here to talk about his amazing multidisciplinary, kind of multi-geographic across Southern California, alcohol-related liver and cirrhosis center. And the point is for him to tell us about what they're doing so we can establish more connections. So thanks for coming, Hide.
Thank you. Hi, Hidetsu Kamoto. Most of you may not know me. I've been here last 28 years. And I think the reason why I'm here, I was invited by Adam, is our center, the center I direct, is for the diseases caused by addiction to alcohol, namely alcoholic liver and pancreatic diseases, abbreviated as ALPD, and cirrhosis. What I want to do is I'm going to just give you an overview of the center. And I noticed, just listening to you guys this morning, that there's a lot of overlaps. And there are a lot of common grounds and areas of mutual interest. And I hope that by introducing the center briefly to you, we may be able to identify the future opportunities. Let's see. Advance is this way? Here we go. So this is a geographical distribution center members. It is a P50 program funded in 1999, and we are ending in 24th year. We just submitted a 5th renewal last month after 2 retreats, 5 months, and 741 pages of hard work. We'll see what happens. If it's successful, our history is going to be extended to 30 years. But anyway, these investigators shown here, representing 6 major institutions, are unified by the common mission, that is to be a leader in research, treatment, education, outreach of alcoholic liver disease and pancreatic disease and cirrhosis. And let me see here, I'm doing, there we go. The reason why alcoholic liver disease is important is that you see here, and globally, 1.5 million deaths occurs due to cirrhosis or liver cancer, and of which about 25% of them is due to alcohol globally. But in the United States, as you see, percentage is about 1/3. Okay, 1/3 of this death due to chronic liver damage is due to alcohol, and alcohol-associated liver cancer is second fast-growing cause of liver cancer death globally. So this is how important this is. That's why we have research center here. Now, our center strives for cutting-edge cell type specific cell and molecular basic biology we do to define the molecular targets for the treatment and using preclinical but clinically relevant mouse models, including humanized models. And obviously bridging that science to bedside. Now, this is a roster of center members, 60 of them. But what I want you to notice is those people who highlight in blue are the second generation of investigators who are trained in the first generation center members and got successful, established a career, and now leading a center activity and governance now. And those highlighted in yellows are the third generation investigators who are trained by second generation investigators. Many of them are early NIH-funded early career investigators. So collectively, we have about more than half of these center members represented by newer generations. And we are really pleased to have this summarized for renewal because I think this is a test to our success of academic enrichment program we had in the past 24 years. Now, this shows you this is the kind of things you have to include in your center renewal applications, how collaborative you are, and shown by dotted lines, and those center members of the 6 institutions. So this collaborative environment is very important because this leads to increase in research base. Now, critical element in center application is centerness. What is the centerness? One of the elements is achieving more than sum of the parts. If you're collecting everybody's glance and showing, okay, this is research base, of course, that's additive. Of course, it's equal to sum. But as a center, you have to achieve more than the sum of our parts. I think the reason why we achieve this growth is shown here, multiple PI grants. 11 UO1 program project, multi-PRO1 grants, and 3 DoD program project, which is additional grants based upon a collaboration. I think this is one of the reasons that we're able to grow to some extent. And another reason, as I already mentioned to you, early career investigators. And 8 of them got R01 grants, generated $8 million on direct costs, and 7 out of them are due to support from pilot project program we have provided. And it's a great outcome of an investment of $0.36 million pilot project funds we provided. Now, our academic enrichment begins with undergraduate students. Introducing into this summer fellowship program and introducing them to Center Investigator Laboratory to do the research training and do didactic graduate course teaching on the topics that we are interested in, and obviously postdoctoral training. And out of about 10% of postdoc we have trained the past 10 years has advanced to faculty position in USC institutions. Another element of centerness is, are we serving as a national resource? Are we serving as a regional resource? And one example is Animal Core we have produces this animal model, unique animal models. 2,400 mice has been produced for 40 investigators, including 15 non-center investigators across the nations, providing those mice biospecimens and supporting their grant application acquisition. This is one of the important requirements of centerness. Now, this is updated organizational structure. What's shown here in the box is 3 technical cores. One animal core produces animal models, as I described to you. Integrated liver cell core is funded by another mechanism, but isolate these cells, 7 types of different cell types from that disease liver, or do the lineage cell tracing, trace the fate of each type of cells in vivo animal models, and we have a morphology core. 4 research projects are now spearheaded by second-generation investigators. Now, we do have an outreach program as well, even though we are not P60 program, P50 program. That means the difference is this usually outreach. You get extra $100,000 or something like that to do outreach. But we still do outreach here. And with the support of those people listed here, because after all, disease we are interested in is a disease of our community and across the globe. Now, this is a very important component, thematic research programs. We create these groups, like you creating this group of interest. These are the basis for the multiple PI grants. These groups have generated those multiple PI grants. Now, of course, translational research is important. Briefly describing this is a list of translational research pursued by key center members, including Tatiana Quesavera's work with anti-IL-17 modality treatment in preclinical study, now translated into clinical trial using anti-IL-23 antibody for alcoholic liver disease, because IL-23 antibody blocks IL-17 pathway. Schnabel has doing a phase 1 study to target unique gut microbiota that's Enterococcus faecalis, which is shown to be in his elegant Nature papers to be important in alcoholic hepatitis. Now, Steve Pando is doing simvastatin treatment acute pancreatitis based upon the preclinical study we did. Now, since this is Addictions Institute, we need to talk a little bit about addiction. 2 interesting stories. By studying the mechanism of liver disease, we need to learn about the intestine, liver, and brain. That's what's happening here, right? And through this investigation, we came across the potential modality to control the alcohol preference or potential alcohol addiction. One example is IL-17. As I mentioned to you, anti-IL-17 modality is already in phase 1 trial. And in fact, in animal model work shown here, is the mice are exposed to vapor ethanol and they consume more alcohol, right? But if you give anti-IL-17 antibody, that increases alcohol preference is completely blocked, shown here. It's suggesting IL-17 may be mediating this alcohol preference. In fact, this antibody also suppressed neuroinflammation, as Daryl has been working on this neuroinflammation alcohol addiction. It's the same story. In this case, IL-17. The other interesting story, gut microbiota. Now, there is ethanol-producing gut microbiota, as you may know. There is a syndrome called autobrewery syndrome. Those people who don't drink alcohol, but they get drunk because gut bacteria produces ethanol without knowing. Ethanol goes up, and the liver is getting damaged. Okay, this is microbe-mediated fermentation. So if you transplant this fecal material to the mice, and control healthy fecal material is transferred to the mice, and give alcohol, what happens? Those who are transplanted with alcohol syndrome consume more alcohol, and in the liver, the enzymes which metabolize alcohol are induced. And in fact, this gives a great notion as to potentially this ethanol-producing microbe may be priming those individuals for more alcohol preference, because even without drinking alcohol, this alcohol produced is inducing alcohol metabolism enzyme. Therefore, they may be promoting this alcohol addiction. In fact, alcohol-addicted people have an increased level of this ethanol-producing gut microbiota at the same time. So this is actually a pilot study we funded, and this is a quite interesting new area of exploration I just want to share with you. But anyway, all the center information is shown in this website, and we would like to welcome any interactive interaction between us and your group. Thank you.
All right. Before we get to this, I thought maybe we could do a little stretch break. We've been sitting and listening for a little while, so feel free to get up and move, and I got really cold. While you guys do that, I am going to announce our first raffle. So let me turn my volume up because there's really cool app music on here. So just wanted to take a quick little break. Look at that. So fun, so fun. So our first winner is Lynn Miller. Yay! All right. Adam, do you mind? All right, so while you guys are up and stretching, feel free to stay up. I'm just going to quickly talk about our IAS pilot grant program. So really the goal of this was to support some developmental projects for subsequent larger grants. The projects that were submitted had to be transdisciplinary in nature, involving investigators from at least 2 schools or departments. And a priority was placed on projects for underrepresented populations. And so we got a lot of submissions, not last year, but the year before, and we were able to fund last year 7 programs, over $200,000 in funding. We heard from them at our last retreat, and we thought it'd be nice if we just got a quick snippet from our recipients and grant awardees and to give us some updates. So not everybody's here. We do have video recordings of the people who are not, but with that said, I will turn it over to Denise to come up and share.
Hi everyone. You'll have to excuse me. I'm fighting a lingering cough, so I have a cough drop. But my name is Denise Tran, and I'm a postdoctoral researcher. And I work with Dr. Eric Peterson and Jordan Davis, who are amazing. And I'm excited to talk about my research here. It was a qualitative study where I conducted focus groups with 40 young adults, ages 18 to 24, who either currently use e-cigarettes, formerly vape e-cigarettes, or who initiated their nicotine use with e-cigarettes, but then later on progressed to using combustible cigarettes. And we were interested in asking them about their experiences with vaping, including experiences with quitting, any barriers that they face with quitting e-cigarettes, facilitators that helped. And the meat of this study was we wanted to ask them about what they would like to see in an intervention that targeted reducing e-cigarette use and also targeted reducing this potential risk for future cigarette smoking. And so that's what I'll be talking about. Okay. So some of the main themes that we saw during the focus groups was they wanted to see peer support in this intervention. So one participant said, I think it would be really cool to give anonymous support to your peers who are also going through the program, or just some kind of encouragement. You could post on a board under an anonymous name and be like, oh, well, I just hit X amount of days, or whatever, and get like feedback and support. Just to know that you're going through it with them would be really neat. Another common theme that they wanted to see was education about the harms of vaping and also the harms of cigarette use too. So for example, one participant said, it's very hard for people our age, like young people, to see past what's going on right now and into the future, because I think everyone knows vaping and smoking cigs is definitely gonna hurt me when I'm like 60, 70, but I don't think anybody's really thinking about how it's impacting us right now. It's like, oh, we're young, we're healthy, like nothing can hurt us. So I think really like emphasizing this isn't just something that's gonna hurt you in the future. These are the impacts that you're undergoing now because you do this. I think that would be something useful just within like this demographic in particular. Participants also wanted to see progress tracking, a way to track how long they've been vape-free, for example. And so one person said, I think having reminders of milestones or something could be helpful, like you've been 1 week clean, or you haven't bought a vape this week. Just seeing how much time has passed and being able to do it like day by day. People also want to see gamification. So for example, one person said, I think adding some little milestone achievements would be cool. Just cute little badges or something simple, just to give you some dopamine for reaching like 30 days vape-free, however long it may be. I feel like that's something simple and easy, just could subconsciously help people want to continue on what they're quitting. And then this last slide I have outlines some of the themes that we saw with participants who transitioned to cigarette smoking, what they thought would have been helpful for them to help prevent their own transition had these been available for them. And so one participant said they would love to have been taught refusal skills in response to offers to smoke. So for example, she said, I was in the DARE program and I knew the concept of peer pressure. I knew that I shouldn't let it get to me, but when I actually get in the moment in a situation, it goes out the window. So in my opinion, I really don't feel like it was effective. And then another common theme was they wanted to see testimony of real smokers. So for example, one person said, videos are just content from actual people that was actually quit or working towards quitting. I see a lot of anti-smoking commercials, and they're always actors that are paid. So it'd be really cool to actually see someone actually doing it instead of just being an actor. And that's all I have. But I'm happy to talk about other themes if you would like.
Yeah. And that pilot grant is related to and in support of your KO1, which hopefully is being considered for funding. So congratulations to Denise, and that's exactly why we do this. And then I just want to say one thing, just to clarify what Vicki had said. As part of our program, we incentivize applications from scientists of color, and they get a higher budget. So that's what she meant.
Thank
and
you.
So we were really pleased to get a diverse pool of candidates submitting. And so, anyway, just excited about that.
If you guys want to come sit here. All right. So just in the interest of time and to get you all fed for lunch, we're going to go ahead and post anybody's videos who are not here today, and you'll get a chance to check those out on your own, and we'll just keep moving on. So we have, Dr. Lorraine Kelly Kwan was the PI for this, but she has Marjorie here who is going to talk about the updates and the work they've been working on together.
Hi, I'm Marjorie Odegaard. I'm a general surgery resident and a postdoc in the lab of Dr. Lorraine Kelly-Kwan, and today I'll be giving an update on our projects for which we've received IAS funding. As a background, most adolescents who undergo surgery receive more opioids than they use after surgery, and adolescents are at risk for opioid misuse and diversion more than other children and also adults. Also, there is just a general lack of understanding of the drivers of opioid use after surgery. So our aims were twofold, with the first aim being two parts. So we wanted to evaluate themes surrounding parents and adolescents' perceptions and knowledge of safe opioid prescription opioid use, storage, and disposal. Develop an educational brochure that targets families with learning aids to improve safe opioid use, storage, and disposal. And then also identify changes in surgeon prescribing after surgeon-reported opioid prescribing as compared to real-world opioid use for adolescents undergoing surgery. And so to achieve our first aim, we did conduct focus groups for which we recruited from a previous longitudinal survey of adolescents who underwent surgery and their parents. We balanced for race and ethnicity, health, literacy, and also language preference, and ended up with 4 focus groups of English-speaking adolescents, adolescents who spoke Spanish at home, primarily English-speaking patients, and primarily Spanish-speaking parents. And so the feedback from those groups fell into 5 major themes. The first was that parents generally had a fear that their adolescent would suffer from an overdose or addiction from taking opioids. And the second was that parents did feel empowered to control or limit their adolescents' opioid use, and adolescents trusted them to do that, but did also take it upon themselves to limit their use if they felt that they were not working for them or if they were having side effects that they didn't want. The third was that both adolescents and parents expressed a desire for and also practice either non-opioid medication use or non-pharmacological therapies overall to minimize their use. And then the fourth theme was that several adolescents and parents expressed being in households that had a culture of just not taking any medications at all, and therefore questioned the value of using opioids at all. And the last general theme was that while both adolescents and parents expressed having a prior knowledge of opioids from non-healthcare sources, the adolescents who had undergone surgery expressed a more nuanced view of opioids and realized that they could be useful in certain situations. So these findings will be presented this February at the Academic Surgical Congress, and then we have also submitted the manuscript as well. And then we also wanted to use these focus groups to evaluate a current brochure about postoperative opioid use in children. This is the one on the bottom of the screen that was put out by the American College of Surgeons. So regarding the brochure feedback, that fell into 4 major themes. The first being that parents felt that the brochure did not meet in individual needs and wanted more surgery-specific guidelines. The second was that parents wanted more guidance about managing side effects of opioids and wanted to know which ones were okay to manage versus which ones should prompt them to stop giving opioids. The third theme being that both adolescents and parents felt that the brochure was not user-friendly given the length and also what they felt were a lack of visuals. Also, I did want to mention that this brochure is only offered in English, so we did have to have it translated to Spanish. And then the last theme to end on a good note was that both adolescents and parents did say that they learned a lot of new information about safe opioid storage and disposal from the brochure. So these findings were presented last October, and we are currently working on that manuscript. To meet our second aim, we are working on a surgeon survey that we will administer to general pediatric surgery, orthopedic surgery, ENT, and also cardiothoracic surgery. We'll be giving them 6 scenarios and then asking them if they would prescribe opioids, and if so, how much and at what dose. And then once they've answered those, we'll give them the real data of children at CHLA who had undergone those surgeries and how much medication they took, and ask them to reflect and see if based on that data they would actually change what they do in practice. The survey has been built and we are beta testing it right now with the plan to have it out this spring. So next steps, we are currently developing our own CHLA specific brochure based on the feedback from the focus groups. And then we plan to use the survey to provide pilot data for an eventual randomized control trial that will randomize surgeons to receive feedback in real time about post-operative opioid use from their own patients. Thank you for your time today, and I can take any questions.
All right, Nina, I think you're up.
Hi, everyone. My name is Nina. I am a 6th year graduating this year, PhD student, dual degree MPH here at USC. And I'm really excited to be chatting with you today about social connection and substance use, work that the IAS pilot grant has funded. So a little bit of background on my general research interests. I got really interested in the relationship between social connection, social feelings, all of us bonding here today, and how that relates to substance use. And so there's a lot of evidence that there are links here. I'm not going to go into all the background of that, just it does exist. And I'm particularly interested in the relationship between social connection and opioid use. And so there's a pretty wide body of literature looking at our experiences of, those positive feelings you get when you hang out with family, maybe not, holidays are a little hard, but in general, fun times with people. A lot of that is rooted in the brain's endogenous opioid system. And so that's modulating a lot of our ability to feel those feelings. And so we have a hypothesis that there is a particularly strong relationship between social connections, relationships, isolation, and opioid use because of this kind of neurobiological underpinning. And so some specific questions bridging from that general idea. The first one we aimed to ask was, does the acute experience of actually using opioids, so when you're taking opioids compared to other drugs, does that mimic the feeling of a secure social attachment? So do you get feelings of feeling secure, feeling positive, loved, sense of belonging? And we found that yes, that does seem to be the case. People who use opioids are more likely to report words like social or secure, positive attachment feelings than people who use other drugs. And the second question we wanted to address is looking at people in recovery from opioid dependence and how people are looking at, positive and negative social events in terms of their impact on risk of relapse. And so what we did is we recruited about 250 people who are in recovery from opioid use disorder and about 300 who have no prior history of addiction. And we had them read hypothetical scenarios about people who were in everyday positive and negative situations. So we had them looking at these positive non-social situations. So you got a promotion at work, you won the raffle, good, nice things, more positive, like very high emotional arousal for these, as well as positive social events. So reconnecting with family members, getting engaged, really positive social events. We also asked about negative non-social events, so losing a job, getting laid off, things like that, these negative things that are not particularly social. And then also negative social events, so feeling isolated or rejected by friends or family members. And across the board, people in recovery and people with no history of addiction rated these positive social experiences as being more likely to reduce the risk of relapse, so they're more protective, than these positive non-social events. So they're a little bit stronger in terms of their protective effect. And the same, but in the opposite direction for these negative social events. So negative social events are more risky than negative non-social events. But not everyone was looking at this as negative is bad and positive is good. So specifically for the positive non-social events, getting a promotion, winning, some money in a lottery, things like that, some people were reporting that this actually increases risk of relapse, which is not surprising to a chunk of our grouping here. But what we found is that people in recovery were actually more likely to think this than our group who has no prior history of addiction. So that was interesting, and I wanted to bring that up here. And our last question that we were looking at through the IAS pilot grant is looking at neuroimaging data. So we're looking at brain activity among people in recovery from opioid use disorder, as well as people with no prior history of addiction. Thankfully, that did something weird. But these numbers are actually higher now because this was from last week. We have scanned 2 more. Happy to report we only have 1 scan left, getting scanned on Monday, so very exciting to have reached our pilot project goal here. And so what we're looking at is we're having people look at videos in the scanner that are really positive social and really negative social. So like a scene from The Joker where he's on the bus and things are very sad and blue and dreary. And we're trying to see if we can differentiate activity among our opioid group as well as our control group, specifically in the insula and the anterior cingulate cortex, because those regions have been shown to be active during feelings of social exclusion. And so with that, I just want to say thank you to IAS and all of you for your time and attention here today. If you would like to connect, connections are very important for all of us. There's my information there. Thank you.
Thanks, Nina. Okay, we're gonna try to do something fun that I just got a text about. We're gonna try to take a group photo before lunch. So maybe over there is probably the least invasive place, if we can get that. Everybody? So if you guys got lunch tickets that indicated your menu choice, it would be a really great time to put those out right in front of your plate so the servers know what to drop.